Hi there, everybody. I'm Sam Challey from Northwest Surrogacy Center. I've had the pleasure of meeting most of you, and I'm really happy that you were able to join us today and participate in the presentation. Also with me, we have Dr. Donna Schuurman from San Diego Fertility, Dr. Sandy Tuan, also from San Diego Fertility. I'm going to let them introduce themselves in just a minute. We also have Northwest Surrogacy Center Legal Director, Tabitha Koh, who's going to be here to answer legal questions as well. Just to start off with a brief introduction, I won't do too much here because, again, most of you do know me. But Northwest Surrogacy Center is one of the largest and most successful surrogacy agencies in the US. In 2019, we had 249 babies born through our program in the year alone. We've got 36 employees at our 3 different offices, all of which are currently closed at the moment for really obvious reasons. But I'm really happy to say that all of those employees are able to work from home, and they all are currently working quite hard. Obviously, they're the heart and soul of Northwest Surrogacy Center, and are really what makes everything work in all of this. If there's a message I'd like to have you take away from all of this is that we are fully operational. We're able to offer all the services that we always have, as far as providing matches, screening surrogates, and moving people through this process. As far as kind of the questions for today, I'd love it if you could go ahead and type those questions at any time. I'm going to let the other presenters talk a little bit about themselves, but we'll go ahead and hold on to those questions and hopefully to get to as many of them as possible today. So please feel free to type those in. Without too much further ado, I'm going to start off with having Tabitha talk a little bit about herself and introduce yourself.
Great. Welcome, everybody. I'm Tabitha Koh. As Sam said, I'm the legal director for Northwest Surrogacy Center. So I have an opportunity to really oversee the legal process, the referrals to the attorney team, and to answer whatever various questions come up as you navigate your surrogacy journey with our agency. I also am the managing partner for a fertility law firm, Benef Challey & Co., based here in Portland, Oregon, that operates in Washington and Oregon both. And in that role, I have a chance to really see the nitty-gritty of the legal process as people navigate it. So I'm looking forward to answering your questions today. I would echo what Sam said. This has been a very trying time, we know, for all of us, especially for our clients and for the families out there who have suffered directly from the COVID epidemic. Our hearts really are with all of you. And those of you who have joined us today are, as I see it, we're making a vote for the future. We're looking into creating children and moving forward with a process that is about life and moving forward. And I'm really glad to be on that journey with you. I look forward to answering your questions as they come.
Okay, and how about next up, we have Dr. Donna Schuurman.
Hello, everyone. It's great to be with you today and to help guide and support you through your journey to parenthood. It's wonderful to be working with Northwest Surrogacy Center, really one of the top agencies in the United States that have always supported and guided intended parents every step of the way, from the agency perspective, the surrogacy perspective, and legal perspective. As you may know, I've been in practice for about 21 years. A significant portion of my practice and career has been devoted to helping intended parents in the US and all around the world navigate the journey to parenthood. I know I have my 3 children, and we had fertility issues, and so I know what an incredible journey this could be and how important it is to intended parents. So we're here to support you, to guide you. Our clinic is open. We are conducting weekly webinars to inform, to guide, and support intended parents through this sort of stressful time and troubled times globally. Over the course of the last 21 years of my practice, myself and my partners have also been involved in a great deal of research. Our keen interest has been in the field of IVF, egg donation, and surrogacy. So we've done a lot of research and published many papers in the field, including looking at areas of endometrial receptivity, meaning making the uterus more receptive for embryos to implant, bringing a classification system into our medical field, meaning how do we grade embryos in terms of quality. And then also we have a major research grant currently to look at non-invasive ways of analyzing an embryo and its chromosomes. Since instead of doing the biopsy on the embryo, we're now looking into analyzing the DNA and the culture fluid and the media that is shed, the DNA that's shed into the culture media, and analyzing that without doing the biopsy. So we're continuing our research, continuing the...
We lost Dr. Donishman.
Oh, looks like we lost Dr. Donishman. Dr. Sandy Tuan, I'll leave it to you to
Okay. I'll pick up the
introduce
baton.
yourself. Yeah.
I'll pick up the baton. Hello, everybody. I'm Dr. Sandy Tuan. Thank you so much for being with us today. I know that you're all at home, and I know this is a really unprecedented time, and I think it's a unique opportunity for us to help you keep moving forward in your journey. As Dr. Donishman said, I'm part of San Diego Fertility Center. Him and I have been partners, had the pleasure of being partners for many years now. And our focus really in this practice is taking care of patients who need IVF, but also third-party reproduction. And so we've had the pleasure of working with great partners like Northwest Surrogacy for a long time here. And, you know, I won't belabor the point, but as Dr. Donishman said, there is a lot of information here for us to share to hopefully help you feel more confident and more comfortable with taking the next steps in this incredible journey. And obviously this is a very difficult and challenging time for everybody. But I think, again, I said this before, I think it's a unique opportunity that we could take this time and actually learn and be able to kind of take it step by step and still keeping, you know, your steps on the right path to that journey. And I think we're almost at the point now, I think, where, you know, things are stabilizing. I do think I see the light at the end of the tunnel, and there's hope. And so it's great that we're at this juncture now where hopefully people can start marching forward to their goal, as opposed to being kind of stuck where we felt, even, I feel like a day has seemed like a year in this era. But, you know, we're getting there. So hopefully today you'll gain some helpful insight to be able to help you feel more comfortable and confident about taking that next step.
Okay, thank you all very, very much. So to kind of frame a little bit of the conversation today, I'm going to start with a question for Dr. Donishman. And that really is, what questions are you seeing from intended parents regarding pregnancy and COVID-19? And you know, what do you think that they should know in the area of all of that as it relates to IVF?
And that's a great question, Sam. So I think that one of the concerns or the questions initially that came about with intended parents going through the surrogacy journey is, how does COVID-19 and this particular virus and other viruses affect in vitro fertilization, sperm, eggs, and embryos? We have good evidence for this particular virus and many other viruses, other coronaviruses, rhinoviruses, the hepatitis virus, so many corollaries in regards to in vitro fertilization, that there's no evidence of transmission of this virus via sperm, via eggs, or embryos to the fetus. There's strong support and evidence for this over many years. In fact, there was a recent research report just in the last 24 hours published by Columbia in conjunction with Wuhan University that looked at men who had severe symptoms of COVID-19. What they did was they looked at the semen for evidence of the virus, and they found no evidence of the virus in the semen. So that's actually even further good news and reassuring. But so we are resuming our IVF operations in terms of creating embryos with a great deal of confidence that there's no effect on sperm, eggs, or embryos in regards to COVID-19. The other concern and questions that intended parents have had is, how does COVID-19 affect pregnancy? Again, we looked at studies, continue to monitor studies. The data so far has been very reassuring. When you look at, for example, the risk of transmission of COVID-19 from the surrogate or from the mother to the fetus, there's no evidence of this so-called vertical transmission. There was a study that was published from Wuhan University. They looked at pregnant patients who were admitted with severe symptoms of COVID-19, including severe levels of fever and respiratory distress. And what they did was they looked at amniotic fluid, they looked at cord blood, and once the newborns were born, they looked at nasal and oral swabs for evidence of the virus. And no evidence of the virus was detected in any of those particular samples. Further studies have also looked at this so-called risk of vertical transmission. And at this particular point, we don't have any evidence that the virus is transmitted vertically through the placenta to the fetus. So this is good news. The other factor is, and questions have been, does COVID-19 affect pregnant patients differently than a non-pregnant population? In other words, are pregnant patients more prone to this virus? And when we look at studies that were recently published out of Northwestern University and also out of Cornell and Columbia, pregnant patients do not seem to have or be more prone to having severe symptoms from COVID-19, and they're not more prone to the virus either. So again, recent studies from Northwestern, from other institutions so far do not show pregnant patients being more prone or having a more proclivity to having severe symptoms. So again, the data so far has been reassuring, but we need to continue to monitor the data, and I'm sure as the number of cases in the United States has increased over the course of the last month or so, we're going to get a lot more research and a lot more data to update you and reassure you. But so far, the data has been reassuring. The other factor is, and I think that one of the concerns was that if there is treatment for COVID-19, are pregnant patients eligible for that treatment and those medications? And right now, two areas are being looked at. For example, chloroquine has been used in the treatment of COVID-19, and chloroquine is safe in all 3 trimesters of pregnancy and can be used for patients who are pregnant if they were to have severe symptoms. And then the other very promising medication, and we touched upon this on our Facebook page as well, there's an antiviral medication called remdesivir. And the initial studies out of University of Chicago, in fact, some of the results were leaked just recently as 48 hours ago, have been extremely promising, meaning that patients who took this particular medication, antiviral medication, and the way it works is it prevents replication of the virus, had a very rapid recovery from their fever and respiratory symptoms. And in fact, at the University of Chicago, 133 patients who underwent the remdesivir treatment, 125 of them have already been discharged. So that's good news, and all of them were admitted with severe COVID-19 symptoms. This particular medication can also be used during pregnancy as well. So I think data has been reassuring, but we need to be vigilant, and we need to continue to update you in regard to the latest research and studies, and we will do so, support you, guide you, and really it's our responsibility to keep abreast of the latest medical studies and research studies on this particular topic.
Thank you, Dr. Donna Schuurman. For a question for Dr. Tuan, what things can intended parents do now to kind of get this process started and moving forward?
Sure. I think that's a great question, Sam. I think we're all looking for things that we can do while we are all at home. And I think there's many things that people can do, because fertility is a long process. There's many steps before you get to that final step of the embryo transfer. And so there's lots of prep work to be done. And I actually feel that the patients who are actually starting their journey now, probably they're not going to see a huge impact on their timeline if things continue to go the direction that we're seeing, which is slowly reopening certain areas of the country. And certainly there's, as you mentioned, your team is still fully functional and working. So I think there's lots of things that have to be done, the backstage, right, work, so to speak, that, still can be done and continue forward. So let me kind of break it down into kind of two segments. So I kind of break it down into patients who need to create embryos of their own because they're pursuing IVF with surrogacy versus patients who are doing egg donation and surrogacy, and what are the things that they can be doing. I think first and foremost, do your consultations, right? Everybody, your physicians are open for medicine consults. And even before this, most of our majority, I would say, of patients that are traveling from outside of the country, or we have many patients that come from different states, we are very accustomed to doing telemedicine and making sure that we still get all the things that we need to done and communicate effectively. So get your consultations done and with your physician, because that's going to be kind of your initial steps that will tell you, based on your particular situation, what are the things that you can do. But generically speaking, for patients who are creating their own embryos, you're going to need pre-cycle testing to see your, what your ovarian status is. We need to check, semen analysis, and our center is still offering those kind of pre-cycle screening. Obviously, we're implementing public health ordinances and different things to make it safe for patients to do that. But it's still possible to continue with the diagnostics, because after the diagnostics, you're going to need to regroup with your physician again to talk about your situation and what would be the right treatment plan for you. And obviously, a month ago, we were telling patients that active treatments were on hold. But at this point, we are obviously being very cautious, but we are cycling patients, particularly those with time sensitivity, to their treatment process, right? But we are moving forward with creation of embryos. And so, then that'll plug you into the process of being able to get your treatments done and create embryos. Obviously, patients who are traveling from outside of the area, there will be some more challenges, but I think over the next coming weeks, I think you're going to see that more services are going to start being available at different centers around the country. So I think that we're not going to run into significant issues with that if patients are just starting the process. So, and in parallel with that, patients need to start their process for matching with a surrogate. And as you know very, very well, that there is a timeline to that. And so I think it can definitely be done in parallel so that you're getting pre-prepped and into the process and, the path for matching with the surrogate. And then by the time we have embryos and your surrogate is screened and cleared, I think that we'll be back in a place where we're going to be fully functional in doing embryo transfers. As for patients who are looking for an egg donor and using, doing an egg donation surrogacy cycle, I think they also need that same pre-cycle screening, right, to make sure everything is good. And then the next step is sperm cryopreservation and doing your FDA screening. And that's still possible. I think it's challenging for patients who are, say, coming from Europe right now or from China. But for example, a lot of my Chinese patients, I'm having them go to Hong Kong because they can travel now and sperm can be shipped. We're making arrangements with different centers in Europe so that to try to make that process easier. If patients are still nervous about flying, they can go to, a country that's close by to have the sperm shipped over. So we do have solutions for that. And then if you're looking for an egg donor, that is a process. That's a big project. And usually it takes people some time to feel that, to find the donor that they feel, comfortable with and that they love. And so please get started on that. Talk to the agencies so that you figure out, what's available to you. And certainly our center is still doing egg donor screens. Obviously location is currently a restriction, but by the time you match with your donor, we're going to be able to facilitate, I'm sure, much more. But we are still moving forward with that, with surrogate and donor screening where it's safe and reasonable to do so. So find your donor. That's a long process. And we even have patients who are coming from Europe now who, because our center has such great success rates with egg freezing, we're able to offer that to patients who obviously maybe are nervous about losing their egg donor in this time frame, because these are young women that, may have education or different needs where they might lose their donor, or they're concerned about that. So we can freeze eggs and, create embryos once the sperm arrives. So I think there's lots of things to talk to your physician about to figure out what's right for you and your circumstance, but we do our best to try to keep that ball moving forward. And again, with the surrogacy match process, I think I'm always recommending patients keep that in parallel, so that you can get yourself on that path. Because what we don't want to see happen is that when everything, I think there are many people who are on hold because they're nervous and they don't know what's available to them. And so they're waiting till they feel like everything's opened up. Well, now there could be a bottleneck, right? Because everybody is wanting to then jump into treatment or do things at the same time. And, we're already, a lot of people are already feeling delayed because of COVID. And now, on top of that, there's going to be an artificial bottleneck from, everybody holding back and then rushing in. So I think I've been recommending to anybody that I can, reach out to say, get yourself lined up in the process. It's all about getting yourself prepped so that you're positioned to go the moment everything is back on board and not get fallen behind because you're trying to, kind of rush in with everybody else. So, but there's a lot that we can do, but start with that consult.
Thank you, Dr. Tuan. So next question is a question for Tabitha. Can you give us a brief overview of the legal process as far as surrogacy is concerned and parentage, and share any insights that you might have as far as how that relates to COVID-19 and what we're all looking at?
Yeah, thank you, Sam. I'm happy to do that. For most of you, as you move through your surrogacy journey, you're really going to have two places in the process where you meet an attorney, where you're working with a lawyer. The first one is at the time of contracts, like Sandy was just alluding to, Dr. Schuurman, sorry.
It's okay.
Just alluding to egg donor arrangements, sperm donors, embryo donors. Many of you will have a contract in place with that person. And then, of course, you'll have a contract in place with your surrogate once you're matched. So that's sort of phase one of the legal process. And in terms of the impacts of COVID on that part of the process, there are really very few right now. A couple of things. Attorneys, all of the attorneys in our network in the states of Colorado, Washington, California, and Oregon, where most of Northwest Surrogacy's potential surrogates and surrogates live, all of those legal teams are operational. They're working from home, they're working remotely, they're managing this process through video conferences, but everything is moving forward. So those attorneys are still available if you're at the point that you're matched with an egg donor or a surrogate and you're ready for a contract. I would expect that the doors are open there. There are a few things that are done a little differently. So domestic clients, those of you that live here in the US, often you would have an opportunity to meet with your attorney in person, maybe during the time that you were visiting your fertility clinic. In this current sort of world, it's all going to be remote, but we're well accustomed to doing that, mainly because we've had so many international clients for so many years that the technology is really in place. Even for attorneys that have a fairly low-tech practice, I expect they'll be able to help you very smoothly through that. You might expect some delays in finding a notary or in figuring out how to sign documents with a notary that have the appropriate social distance. Many states have adopted interim loosening of restrictions so that notaries are able to process documents remotely. Or if they're not able to process them remotely, in some states, notaries are increasingly something that we could do without in this current crisis period. So, there will be a few workarounds, but I expect that to go smoothly for you. There are certainly things that we've learned from the COVID epidemic that are making their way into our contracts. And this is how attorneys drafting and reviewing surrogacy contracts have always worked. We watch, we listen, we talk to our clients, and we evolve our contracts as needed to deal with whatever is the current barriers or challenges that might come up. So you should expect to have conversations with your contract lawyers about any additional COVID restriction requirements. For example, asking the surrogate to comply with additional social distancing or hand washing protocols and wearing of a mask. You might look a little bit more closely at the language that has always been present that requires your surrogate to follow medical recommendations in terms of the risks that she takes and the activities that she chooses to do. But you may have specific thoughts or concerns related to travel that might be more restrictive now than it would have been 6 months ago or a year ago. So we would expect that these things are part of the conversation, both in the initial draft contract that you would receive from Northwest Surrogacy Center after your match, and also in the review appointment that you're having with your attorney as you work through that. One other difference that I've seen as people are trying to navigate through this current social distancing and restrictions is that people are looking into the timing of the screening of their surrogate and the reviewing and signing of their contract. There's always been the opportunity for flexibility here. Some families would choose to screen early ahead of the contract and then only undertake the legal contract once they're confident their surrogate meets the requirements of their fertility clinic. Others prefer to do the process in tandem so that there's no delay on either end. And some will just want to make sure the contract is all agreed to and settled in before they begin screening. That will certainly be the case for those of you who have a surrogate who is distant from your clinic and who want to be sure that everything is queued up and ready to go, but are not yet prepared to ask your surrogate to travel to a clinic for screening. So just bear in mind that you have some flexibility in how you time those processes. And certainly the team at Northwest Surrogacy Center is available to help you make those choices as you look at a particular match. For most of you who are just now embarking on the surrogacy process, you don't need to worry a whole lot about what might come when we get to establishing parental rights. That typically happens somewhere between 16 and 20 weeks of pregnancy. So once you've chosen your surrogate, you've been matched, you've completed screening, you have a contract, you've got a pregnancy, and that pregnancy has lasted into the second trimester. You've passed from your fertility clinic's hands into the care of your surrogate's OB. And at that point, it's time to begin talking about phase 2 of your legal process. So I would just say a couple words about that. And if you have particular questions, please feel free to submit them using the Q&A feature and we'll answer them a little later on. Families that have pregnancies in this current world of severe restrictions are needing assistance from their agency and from their attorneys to navigate 3 main processes. The first is getting here, getting into the United States if they live abroad, or traveling here from a distant state to the state where their baby is going to be born. There are lots of strategies that we're using. They're always evolving. We're talking constantly about what might work, what no longer works, what could work differently. So that's a very active area of work for us. Families that are here in the United States and are able to travel to their surrogate's place of delivery will be looking at the rules and restrictions in accessing the hospital. Currently, in all of the states that we work in, at least one intended parent is still able to be at the delivery for almost all hospitals. And after the baby's born, one or often both intended parents can be present to care for the baby in the hospital. We are seeing additional visitors, so grandparents, older siblings, Those folks are no longer permitted into the hospital at this time. We're seeing that hospital waiting rooms are generally closed down, and so the hospital is really trying to limit how many people are coming and going from the building. And we're seeing that they're discharging healthy babies as quickly as they can. So rather than staying in the hospital for 48 hours to benefit from some of that extra TLC from the labor and delivery nurses and the mother-baby nurses, we're seeing families heading home more quickly as soon as they're confident and the baby is stable. Again, just to minimize the amount of time that you're spending in the hospital. And those restrictions may still be in place to some degree at the time your baby is born. We will continue updating as you move through the process, and really makes sense to dig into those questions more deeply once you have a time frame for your baby's delivery. That was more than a few words.
Thanks, Tabitha. So I'm going to go ahead and address one of the questions here, and I'm actually going to divide it between myself, and I'll let Dr. Tuan do the medical portion of it. But the question is, how has the screening process for surrogates been affected? And then this is another question that's part of my portion of it, which is, aren't home visits, and this is home visits by a social worker, part of the screening process? So as far as kind of the screening process in general, our process is not interrupted. We've had, if it's not as many, but perhaps more surrogates contacting us in the last month or so than previously. We have altered some of the processes in the sense that, for example, psychological evaluations previously were done in person. Those are now being done over video conference. But we are still able to complete our interviews, also previously done in person and now over video conference as well. We're doing criminal civil background checks and able to complete those. We are gathering medical records. We're organizing those. We're sending them to our clinic partners for them to review. That process has also not been interrupted in any way. The question about home visits by the social worker is a really good one. So we have done those recently over a video conference or with a video or virtual home visit. Admitting that is not ideal as far as all of this stuff is concerned, but it is also the highest pass rate of any of the screening that we do. So that is to say that very few of our surrogates will get disqualified during a home visit. And most other agencies don't even include that as a part of their screening process. So it's one of the things that perhaps Northwest Surrogacy Center is more careful about, because we still think that it's important. And ideally we will return to doing those in person, but for the moment they have been moved to a virtual home visit. So I guess, yes, the point being is we've altered some of the processes, but we're still doing everything that we have traditionally done. I'll let Dr. Tuan address the second part of that, which is the medical component.
Sure. And just to give you a little bit of background, what do we do as part of the medical screening? So first of all, the initial part of the medical screening is a review of the medical records. That's very important because we're trying to make sure that there are no red flags in the prior pregnancy that could lead to increased risk of complication in a future pregnancy. So, that part, it's not disrupted, as Sam said. We're still continuing with that, and we're able to do that remotely, and we've always done that remotely. So that's worked out just fine. And then the next part, once they've gone through the medical screening of the medical records, usually that's when the surrogate is coming into the clinic for an in-person visit. And during that visit, we're doing blood work. for her, and if she has a partner, doing STD screening for the partner as well. And then we're doing a uterine evaluation, something called a saline infusion sonohistogram. And that the point of that test is to detect whether or not the surrogate has any polyps in her uterus, which is very common among women. And we find it probably about 20% of the time. But that is not something that's going to disrupt your journey. That is something where, you know, if we find it, we usually recommend a minor procedure to remove the polyps, and then off you go. So for that reason, what we've decided now in our clinic to do is for surrogates who can get here, and if they're local to the California area, that's very easy. They're still coming in. We're obviously spacing out the visits and screening patients before they come into the center. So all the public health protocols that they're doing in the hospitals, we're doing the same thing here, temperature checks, etc. But basically we would do that visit still, but they're just a little bit spaced out, and we're doing a more limited number of people, you know, at a time. However, if your surrogate does live, you know, out of the area and is not able to travel here, we've basically continued with a unique process. Basically what we do now is we do a telemedicine visit with her, do a consult, take a complete history, everything that we would normally do. We are sending the lab slips for her to do those labs to a laboratory closer to her home, because those are all still available. So we'll do some research and find a place that's easy for her to get to, so that we're not delaying the blood work being done. And then what we're doing is saying that if everything we're seeing in the medical records and those blood work and the visit, the telemedicine visit is okay, then they can go ahead and proceed with the legal process. And when everything calms down and the surrogate is able to travel again, then we will have the surrogate come in and do the sonohistogram and the in-person visit. Because to Sam's point, you know, with the home visits, you know, we're not usually disqualifying a surrogate based on what we're finding on the sonohistogram. Typically, that is something that if we find a polyp, it's a problem that can be resolved, and she'll be perfectly healthy and well to continue in the journey. And so that is not something that's going to hold up, you know, in terms of the ability to continue, right? So I think that we feel comfortable delaying that until she can come for an in-person visit, but we want to keep the process moving along, because the legal process can take time. And so we want to make sure that, you know, you can get those contracts done. And as soon as everything is ready, and we can bring her in, we'll do that. If we don't find any polyps, then off you go into your embryo transfer. You know, and I think the timing will be just right. However, I feel like the patients that haven't matched with a surrogate yet at this point, or you're just on the cusp of matching and starting that screening process, I really feel that, you know, things are changing rapidly. Our center, you know, Dr. Donna Schuurman and I, we are constantly meeting, you know, we have 5 of us, 5 physicians, and we're constantly, you know, looking at the news and, you know, figuring out what's reasonable to do, what more can we add back, and what speed at which we can do that. And so I think that by the time, if you're just on the cusp of a match, by the time your surrogate is ready for the screening, the physical screening, I think we may be in a very different place where people are going to be able to travel. So, but I think for now, at this point in time, that's what we're doing.
Thank you, Dr. Tuan. So another question that we've got here, and Dr. Donna Schuurman, I don't know if you're going to have the answer to this one or not, but it's in regards to a surrogate pumping breast milk and whether COVID-19 is or may be transmissible via breast milk, and if that's a concern for you.
I think at this particular point, the studies are not definitive in regards to the transmission of breast milk. There was a study out of Wuhan University that did not detect the virus in breast milk. But at this particular point, I don't think we are reassured enough from one study to be able to then extrapolate and say that that's something that's safe to do. I think we need further studies. The same issue holds, for example, you know, during pregnancy, the data is reassuring. Most of the studies have been done in the 3rd trimester. So, you know, we need more studies on the 1st and 2nd trimester as well.
Okay, thank you.
And I like to, I'm sorry, I'm just to add one
Please,
thing.
yeah, please.
Which is, I actually, there's, at UCSF has just undertaking a brand new study. It's called the Priority Study. And what they're going to be doing, they're currently recruiting pregnant women and newly pregnant women, because to Dr. Donna Schuurman's point, a lot of these women, that have been studied are the third trimester, because obviously people are very concerned about transmission during delivery, vertical transmission. But I think with this new study, hopefully, if they're able to recruit a larger number of patients, they could follow from beginning of pregnancy and then again reinforcing all the way through. And then obviously they're checking patients from different stages, then we're going to get more data on, because the questions on people's, is being pregnant in the first trimester going to cause any problems, if I'm exposed to this virus, and all the way to the breast milk question. But obviously we think breast milk is great, and there could be even antibodies that could be helpful in preventing the, to protect the baby. But I think it's a limited number of case studies now that we're following. And so I think we need that big study to help us bolster our confidence in that.
Got it. Okay. So a question for Tabitha. There was recently the state of New York legalized compensated surrogacy. And do you anticipate that having any effect on as far as intended parents who might live there? Or, to be clear, we only recruit surrogates from Oregon, Washington, California, and Colorado. But what impacts do you see that having on intended parents?
Yeah, I mean, there are a couple of really positive impacts. This is the New York Child Parent Security Act that was passed April 2nd. So a little bit of bright news for us out of New York. It doesn't actually come into force for nearly a year. So it will be February of next year that it actually is in play as a law for those folks. But one of the great things is it signals, again, another step in this general movement towards legalizing and codifying compensated surrogacy and giving additional support and backup for families who are pursuing surrogacy. We've always worked with intended parents from New York, and intended parents from New York that have a surrogate giving birth in a state where it's legal and who are pursuing the legal proceedings in that state have been just fine to go home. Having said that, it's very nice to know that you're going home to a state, to a jurisdiction that recognizes and supports the appropriateness of what you've done, and that your path to parenthood is acknowledged by your home state. So I think it's a general lift for all of us. I don't expect it to change the availability of the legal processes in our Western states, which have always been present.
Thanks, Tabitha. So here's a question about, and I'll try and paraphrase it because it's kind of long. But it does have to do with a surrogate traveling from outside the state. And I think you addressed this a little bit, but if Dr. Donna Schuurman, you could clarify just a little bit about, when you think that's likely to be possible. And I'm not going to hold you to it. We know that this is, there's forces beyond your control here. Right. And the same would go for a donor traveling from out of state. When or right. What do you think we need to get that part done?
Actually, we're optimistic, for a number of reasons, that this is something that we can do actually for travel for surrogates and egg donors within the coming months. And the reason we're optimistic is for several reasons. Number one, the majority of the states that were hard hit with the COVID-19 virus seem to have been plateauing in terms of the rate of hospitalizations. And so that's good news. In particular, in California, for example, I think our rates have been fairly stable for many, many weeks. In fact, in California and Oregon, in Washington state, the governors are starting to talk about a phased reopening of the businesses and economies. So I think that's good news. I think travel will follow after that. And I do think that many businesses, many enterprises, including airlines, have placed very stringent screening measures, health measures, sanitizing the plane, for example, after each particular flight. So I think it actually is sort of less chance for us to be able to now catch something and contract something on an airplane now than it was maybe even 3 months ago because of those particular stringent measures. So I think some good news. There's some good news also in regards to the antibody front, meaning that there's more testing being done. There was a recent study out of the University of Southern California that showed that a significant portion of the population is asymptomatic when they have the virus. What that means is that through antibody testing, we'll be able to see who's immune, because what that means is that eventually we're going to have herd immunity. And so those particular patients are going to feel more comfortable coming back to the workforce, to schools, because we're going to have antibody testing to show that they have immunity. Maybe not lifelong immunity, but at least immunity potentially for this season, according to Dr. Fauci at the CDC. So for those particular reasons, and we also think that potentially the first vaccines may be out by the fall. We may be looking at September, October, with the first vaccine trials being completed, and then subsequently the vaccines being sort of scaled and being available globally. That would then also raise confidence. So I do think that for donors and surrogates who live out of town or out of the state who need to travel via plane, I do think that we feel optimistic in the next coming months that they'll be able to do so. In the interim, as Dr. Tuan mentioned, we now have protocols in place to initially start that process moving forward, having a video consultation with the surrogate and the egg donor, doing some of the workup locally where the egg donor and surrogate live, and then subsequently in the coming month or 2 months, scheduling those particular donors and surrogates for in-house visits, to San Diego Fertility Center, so that we can complete the process of screening. And again, Dr. Tuan, I think, mentioned something that's really important, and that is that initial screening process is going to really rule out the major factors. Therefore, we feel confident that if those initial screening factors that can be done locally are normal and the parameters are normal, then those particular patients and intended parents can move forward with the legal process, with the legal contracts, and then we can complete other examinations such as the sonohistogram, which we feel confident that if there is an abnormality, that's something that we can resolve before an embryo transfer, before an egg retrieval. So we believe that we can keep the process moving forward. Our clinic is open. We're resuming IVF cycles, and I think the embryo transfers we may resume in the coming months as well. And again, we're always here if you have questions, concerns, here to support you, to answer your questions and concerns in regards to your surrogate and egg donors.
Right. So a question for Dr. Tuan, not necessarily COVID related, but this is one about what if my surrogate has a failed transfer? Do you recommend that I work with the same surrogate, or should I go find another one, or what's your recommendation?
Right. And obviously, whenever you have a failed transfer, it's always heartbreaking. And, you worked your way up to this, big anticipation, and we want to be successful. And there are many first transfers that are successful. However, just as nature goes, not every single one of the embryos that are created, even when you're using a young egg donor, is going to be perfect. And I think when an embryo doesn't implant, it's really nature's way of preventing you from having an unhealthy pregnancy. And so I try to take it back to that perspective of, if you're, you have 10, 25-year-old women, some of them are going to get pregnant the first month, and some of them might take them 6 to 8 months. They're all going to have healthy babies. And so there's just a timing there with the embryo. So the majority of the time when an initial transfer is not successful, I think it usually comes down to embryo quality. And so it's not necessarily that there's something wrong with the surrogate or her uterus, because these are women who have proven fertility, who have been pregnant before. So their receptivity to the embryo should be normal, just based on the fact that they've been pregnant and have carried and delivered before on their own without problems. And so typically I will recommend that patients continue to work with the surrogate. The reason why in the contract it's written for 3 transfers is because sometimes just out of luck or whatever it is with your embryo quality, that it may take multiple transfers to get to that, you know, the right embryo, the right one. I call it the champion. You know, I think of the blastocyst embryos are semi-finalists, and they all look beautiful, and sometimes it's hard to tell them apart. It's like the runner-up in a beauty contest, right? So can't tell who's going to be, you know, your Miss USA and who's going to be your runner-up. And so you just have to put it in the uterus and give it a chance. And so think of the transfers as that opportunity for the embryo, but it's really not anything that the surrogate did or something's wrong with her uterine environment. I think if we have the unfortunate situation where we get beyond 3 transfers and we're not successful, then we really need to sit down and talk about, okay, what's going on with the embryo quality? What's going on there? And then, yes, at that point, you would consider potentially changing the surrogate candidate. But even then, sometimes I don't know that it's because of the surrogate as much as it is, but we've gotten to that 3. And so, okay, maybe it's time to change and move on. But in the initial one, I definitely think let's give her another chance. I think you may find that you're going to find success on the second one. So keep the faith.
Yeah, and just to add to that on our side, what we see is that when we find people doing 2nd and 3rd embryo transfers, their probabilities of success is almost exactly the same as on the 1st transfer.
Yeah, and we've looked at that. I mean, I think it's about 98% of the time, if you're using an egg donor and you have healthy embryos, if you get to the 3rd transfer, over 98% of the people are pregnant. So that's, you know, there's always going to be, it's biology. So there's always going to be unusual circumstances that, you know, people can fall into unique situations. Or if the woman is older, obviously that's a ovarian issue and a quality issue that can impact success rates. But what it comes down to is that, you know, the uterus is really just the receptacle. I think of it as the analogy, not to minimize the gift that they're giving, but if I was using an analogy, it's like this is the oven, right? And so how good the bread turns out depends on the dough that you put in, and that depends on the egg and the sperm. And sperm quality makes a difference too. So, but it's usually not the surrogate. So definitely, you know, I support continuing with the same surrogate.
Got it. Thank you. And kind of a follow-up to that, and this is kind of the last question that we have, and I'll switch doctors for a moment. There's a question about being tested for COVID antibodies, which I think some of those tests are seeming to come online. And this is in the interest and context of protecting a newborn. What's your thoughts on that, Dr. Donna Schuurman?
So you have to be very careful with antibody testing, and this is the reason why. Because the recent antibody test kits that have been actually purchased by different governments, you know, for example, the UK government purchased about 3.5 million kits. The German government did the same at several 100,000. And it seems like the initial test kits that were available have very low accuracy in determining immunity and determining the presence of antibodies. Now, why are antibodies important? Because if we can determine whether an antibody response has been made, those particular patients are immune, at least from reinfection, the majority of them, although some patients, it's possible that some patients may not create antibodies. So the antibody testing is important. Now, at this particular juncture, based on CDC's latest guidelines, if the antibody tests that you're utilizing are basically these pinprick tests that can be done at home or even in a non-lab environment, those are not sensitive enough at this particular point to rely upon. So the best antibody testing that we have right now are based on a protocol called the ELISA protocol. An ELISA protocol needs to be done in a lab, in a laboratory. There are many labs that we can guide you to in terms of that are doing antibody testing. And these take about 3 to 4 hours to get the results. Some of the labs can actually process many of these antibody tests in a given day. The antibody testing will also give us information as to whether there may be active infection, because there's a certain type of antibody that is more prevalent when there's an active infection. And then once that active infection abates, then you have something called IgG formation, which gives you further long-lasting immunity. As I said, at least we think for this season, possibly longer. So you got to be very careful with antibody testing, because some of them are not accurate and cannot be relied upon. At this particular point, the most reliable ones are the ones that are done in labs based on an ELISA platform. There are many companies, including Abbott, including Johnson & Johnson, including Gilead, that are working on more accurate at-home test kits. So far, they're not as accurate as the ones that are being run in the labs.
Thank you. So I did have one last question that I want to ask, and I'm gonna ask this to Dr. Tuan, and that is, does the virus affect the quality of eggs or cause genetic conditions in donors which may carry risk of passing on to children?
I would say absolutely not. So I think that you have to know that this virus has caused a pandemic because it's so infectious, right? And it's causing these respiratory symptoms. But in reality, it's a coronavirus, which is a very, very common virus. It just happens to be a very unique strain. So when you think about coronaviruses and the common cold and the flu that we get, it's never been shown that these types of viruses can lead to any impact on your reproductive cells. And so I want to use that same logic and apply it here. This is a unique strain that has caused problems because of how infectious it is, but in terms of how it behaves otherwise, I think you can use the example in our knowledge of be it SARS or just other coronaviruses and know that, you know, it's not going to have those types of impacts. So it's not going to negatively impact your eggs or cause any mutations or anything like that. I do think that part of the reason why we're being cautious about resuming embryo transfers right at this second in time is because we do know that when women get febrile illnesses, be it because of COVID or other reasons, right? There's many other reasons you get high fevers. We do know that that can be associated with a slightly higher chance of a miscarriage in the first trimester. And so because of that reason, and because, you know, there's been this peak, right? We've been racing towards a peak and now things are plateauing. So I think it makes sense to hold off for a bit on trying to get pregnant and trying to do the embryo transfer when you have control over the timing, because it's good to let that peak pass. After that, is it still going to potentially be around in our environment where we're going to be exposed? Sure, you still have to be careful, but it's not going to be at that peak where the surge, right, where everybody around you may be an asymptomatic carrier. So I think it's just exercising that caution. The CDC has not come out, or any of the American College of Obstetrician and Gynecologists, none of them have come out to say, hey, don't get pregnant in this time. They've not said that to women who are just trying to conceive, you know, unassisted. So that's an important point. But I think that when we're doing fertility treatments, we do have an option of potentially delaying. And I think it makes sense to try to avoid, because what patients are going through to get those embryos and to get to that point, it's just such a greater investment of time and energy. And so I think it makes sense to say, let's wait till the peak has passed. And then at that point, I think we do the transfer. And I think we're not far off from that, you know, and so I think it's a brief moment of caution to try to minimize that risk of miscarriage. But no, I'm not concerned, and that's why we're moving forward with retrieving eggs and creating embryos, because we really don't feel that there's any impact on egg quality, sperm quality, you know, embryo quality, or future, you know, the health of future children created from those embryos.
Thanks, Dr. Tuan. So we are up on our hour. So what I'd kind of like to do just in summary is the first thing I want to say is thank you to all the people who have attended and spent their time with us. We weren't able to get to all of your questions, and there's some very good questions here. I want to encourage you to reach out to any of us. So if you don't have the contact information for San Diego, I'm sure that they'd love to talk with you. Just let Marissa or Caitlin on our team know, and we'd be happy to put you into contact with them. Same goes for Tabitha. You know, if you have additional questions, concerns, I know that she'd be happy to speak with you about all of that stuff. I also want to say that we truly do value our partnership with San Diego. Truly excellent success rates. They're very good at doing the important stuff that we don't do, which of course is getting you pregnant. And we enjoy working with them. So again, if you'd like a referral or anything else, please do let us know. I also want to thank you for kind of the positive messages, and we really have seen not only from San Diego, but our other clinic partners, really kind of optimistic messaging, and people are moving to kind of reopening and providing full services. So that's exciting for us. Again, please don't hesitate to reach out with your questions, concerns. Love to talk with you if we haven't already. Sandy, Tabitha, Saeed, thanks for your time.
Thanks so much. Great.
Thank you,
so much. You guys take care. Stay healthy. Okay.
Thank you, everyone.
Bye.
Okay.
Cheers. Bye-bye.